Hello, it's Dr. Rhonda Johnson. Today's Tuesday, December 28th, and today I'm talking about Omicron infections in babies and kids. While Omicron is the most infectious virus to hit the U.S. since measles, and infections are doubling every 48 to 72 hours, the American Academy of Pediatric says that Omicron infections in children are extremely high, and pediatric hospitalizations have increased 35% nationwide. As always, my advice is that you talk to your child's healthcare provider about any illness your child may be experiencing, and also about how to keep your children healthy during this pandemic. But let's review the symptoms of Omicron and COVID in kids and teens. The most common symptoms that are reported with Omicron include runny nose, headache, fatigue or tiredness, sneezing, sore throat, and fever. Now, some kids also have body aches, vomiting, and diarrhea. Now, parents, there's no way to know if it's COVID unless your child is tested. So what about the babies? Well, pediatricians are still learning how Omicron affects babies, but many babies, if they do have symptoms, they may include fever, lack of activity, a runny nose, cough, rapid breathing or breathing problems, vomiting, diarrhea, and feeding issues. So how do you protect your children from Omicron? Well, parents, you've got to get vaccinated and boosted, and make sure your kids who are 5 and up get the COVID vaccine. You know, teens 16 to 17 can get a booster shot 6 months after their second dose of their original series. Now, if children are 2 and up, they should wear masks in public, especially around people who aren't inside their immediate household and if they're using public transportation. Please be mindful of crowded indoor settings that do not have good air circulation. If your kids are in school and there's free testing programs, sign them up for the free in-school testing programs. You may want to think about non-essential travel during the next 4 to 6 weeks, when Omicron infections are expected to peak. And always remember, parents, not to use hand sanitizer around babies and toddlers. So when should you be concerned about taking your children to the emergency room? If your baby or child seems confused or won't wake up, looks blue around the nose, lips, or skin, has trouble breathing, can't keep any liquids down, and you're concerned about an emergency, please take your child to the nearest emergency room or call 911. Also, parents, you can please keep up with your children's well child visits and your children's vaccines, because that's an important part of protecting your children. That's my message today. My views are my own. Please stay safe and have a blessed day.